Dizziness case studies with cost comparisons from dizzinessdoctor.com. Thank you. Thank you for your interest in dizzinessdoctor.com. If you are a person suffering from symptoms such as dizziness, imbalance, unsteadiness, disequilibrium, vertigo, etc., then our goal is for you to bring those symptoms under control. If you are a healthcare provider trying to help your patients manage those kinds of symptoms more effectively, then our goal is for you to understand better how to diagnose and treat the underlying disorder. Disclaimer: this material is intended for educational purposes only and does not substitute evaluation by a qualified medical professional. Accessing this material is subject to the terms and conditions detailed at dizzinessdoctor.com. Notes: the costs in US dollars listed in the following cases are approximate and are from the dates on which these individuals were evaluated, some of which were several years ago, and therefore may not reflect current costs. Purpose of this presentation: the problem. Evaluating and treating diseases that cause dizziness can be expensive. The solution: however, some cases can be identified and managed in a more cost-efficient way. We review several instructive cases. Case 1. A common disease. A woman in her early 60s began experiencing brief episodes of spinning dizziness when she would lie down. She was diagnosed with benign paroxysmal positional vertigo, abbreviated BPPV, which is the most common cause of dizziness, involving the posterior canal, which is the most commonly affected part of the ear. She was treated in a clinician's office with the Epley maneuver twice per week for 8 months at a cost of nearly $8,100 with minimal improvement. On our examination, her eye movements showed that she had BPPV involving the lateral canal, which is not treated with the Epley maneuver. After 3 treatments with the Lempert roll, her symptoms finally subsided. The cost of our evaluation and treatment was $835, about 10% of the previous management. Case 2. An uncommon disease. A woman in her 50s had an episode of severe spinning, dizziness, nausea, vomiting, and several right ear symptoms, including fullness, hearing loss, and roaring sounds, all of which improved after about a day. This cluster of symptoms recurred about a month later, at which point she presented to an emergency room. The cost of the evaluation was $4,100, where they performed a head CT, an additional $950, then a brain MRI for an additional $1,580. She was diagnosed with labyrinthitis, inflammation of the inner ear, and treated with oral steroids, $29, with side effects of irritability and insomnia. So the total cost to this point was $6,659. However, the episodes continued to recur with increasing frequency and did not respond to repeated administration of oral steroids. We were suspicious of the initial diagnosis, since it is unusual for labyrinthitis to recur frequently. On our evaluation, an audiogram showed right-sided, low-frequency sensorineural hearing loss, whereas labyrinthitis more commonly involves high-frequency sensorineural hearing loss, and electrocochleography showed increased inner ear pressure on the right. We diagnosed Meniere's disease. The total cost of our evaluation and testing was $870, about 13% of the previous workup. The patient was started on a low-sodium diet, and the frequency of her episodes went from twice per month to about once per year. Case 3. A rare disease. A man in his 70s gradually developed chronic unsteadiness. Over the course of about 2 years, he spent over $37,000 consulting multiple specialists, getting multiple imaging studies, including invasive cerebral angiography twice, which has a 1% risk of causing stroke, and other tests, including a lumbar puncture and a muscle biopsy, but still had no answer. When we evaluated him, his eye examination showed a slow, bouncing eye movement, and his palate oscillated rhythmically and in synchrony with the eye movement. We diagnosed him with oculopalatal tremor. Gabapentin stopped the symptoms. The cost of our evaluation was $340, less than 1% of the cost of his previous workup. The prescription for gabapentin cost $40 per month. Take-home points. Securing the correct diagnosis not only paves the way to relieving a person's symptoms, but is also cost-efficient. Thank you. Thank you for viewing, reading, or listening to this material and for your interest in dizzinessdoctor.com. We welcome your feedback and support. The highest compliment you can give us is to refer our educational materials to others who could benefit from them.